So we're going to do a subcutaneous injection today. So what you need is you need a needle, gauge size either 23, 25, or 26, and then you're also going to need the length is going to have to be 3/8 of an inch, half an inch, or 5/8 of an inch. The injection sites for sub-Q injection is going to be the back of your arm, your outer thigh, your love handles, and your umbilicus. And so what you want to do is once you receive the doctor's order, you want to check the medication 3 times before you give it to the patient. Once whenever you're getting the medication from storage, whenever you're preparing the medication, and then the last time whenever you give it to, or right before you give it to the patient, you want to make sure that it's correct medication. Before you administer the medication, you would want to check the expiration date. And when you walk into the patient's room, you want to introduce yourself and explain the procedure. Use 2 identifiers for the patient. Make sure they don't have any allergies to the medication that you're about to give them. And you want to wash your hands and put on gloves. And you want to use the 6 right, so like right patient, right drug, right dose, right time, right route, and then you want to document it correctly. And so once you get everything ready, we're just using sterile water in this video. You're going to clean the top of the vial. Make sure that's all clean. And then we're going to draw up as much amount of air as we're going to inject in the patient. And we put it in the vial, and then we draw that much out. So I have 0.1 milliliters, and then you're going to want to clean the injection site. And you have to wait for it to air dry. And then you're going to want to grab a 1-inch fat fold, use dart-like motions to inject it, and you go at a 45 to 90 degree angle depending on how much tissue there is. And so then you inject it, and I'm not going to push down because I have the stuff in here. But you take it out and you don't massage the site, and then you want to reassess your patient afterwards to make sure there was no adverse effects and make sure that the medication was actually therapeutic to them.